Gingival flap surgery. Gingival flap surgery is a procedure in which the gums are separated from the teeth and folded back temporarily to allow a dentist to reach the root of the tooth and the bone. Gingival flap surgery is used to treat gum disease. It may be recommended for people with moderate or advanced periodontitis, especially if the initial scaling and root planing has not eliminated the gum infection. It may also be done in conjunction with another procedure known as osseous, that is, bone surgery. After numbing the area with a local anesthetic, the dentist or periodontist will use a scalpel to separate the gums from the teeth and then lift or fold them back in the form of a flap. This gives the periodontist direct access to the roots and bones supporting the teeth. Inflamed tissue is removed from between the teeth and from any holes, that is, defects in the bone. The periodontist will then do scaling and root planing to clean plaque and tartar. If you have bone defects, your periodontist may eliminate them with a procedure called osseous recontouring, which smooths the edges of the bone using files or rotating burrs. After these procedures are completed, the gums will be placed back against the teeth and anchored in place using stitches. Sometimes the periodontists use stitches that have to be removed a week to 10 days after the surgery.